I wanted to talk about one thing in particular, and recently I've gotten about 3 emails from patients who are anywhere from 1 to 10 years after surgery. And they're all about the same thing. And so the one lady I thought was most interesting, she's 10 years from surgery. She actually had it in 2000, and she's done great. She says, but I have diarrhea that's bad once or twice a month. And she wanted to say, hi, Dr. Rutledge, good to hear, good to talk with you. But I have this diarrhea once every month or so, and I want you to fill out a Family Medical Leave Act so I can go to my new job and take off when I have the bad diarrhea. And I said, well, let me talk to you about that because you're not supposed to have diarrhea. And what I wanted to talk about, I had also a radiologist who had surgery with us just about 9 months ago, who's had some gas and diarrhea and cramps, and she wrote to me that she had been to her doctor and felt that she would just have to get used to having diarrhea forever. And so I wanted to talk to you a little bit about that, explain what to expect, and that you shouldn't have a lifetime of diarrhea and cramps, and that if I can explain what's going on, maybe you can help avoid that. So I have a little bit of stuff to go through. I'm going to go through the basic physiology, that is the mechanism of your gut working, the mechanism that the MGB works, why you might get gas or diarrhea, and what to do about it to prevent that. So it's going to take a minute, but then we'll have it as a video, and I'm writing up a big web page with some guidance and things like that. But I have a little bit of work to go through to explain those things, so that not only you this morning, but my patient from 10 years ago and my patient from 6 months ago can kind of understand that. Yeah?
You're going to start with fire or...
In the beginning was the Word.
Okay, continue.
We love your stories.
Yeah, no, they're always, as you know, very brief and to the point. So the first amoeba separates, and then that grows into fish. Okay, so we want to first of all talk about the situation of a patient who comes to see me in the first place. They're heavy, and they have a gut which has a responsibility in life. It's an organ system. Your digestive tract has a purpose in life, just like your eyes and your bones and your brain. It has a job to do. Your eyes see, your brain thinks, your fingers pick up things, the skin protects you from the outside, the bones let you stand up straight, and the gut, its purpose is to digest and absorb fat and calories and vitamins and minerals and things like that. And people who see me, people who are overweight with the associated complications, are living with a gut, an organ system that's doing its job too well. In other words, digesting and absorbing too much fat, too much grease, too many calories. So then the contract between myself, when we do our MGB, and the patient is I'm going to interfere with the digestion and absorption of fat and calories in particular for my patients so that they lose weight. Okay? So that's kind of simple. Now the nice thing about the MGB in some ways is that even after that intervention, you can still eat different things. So after the MGB, if you want to have a piece of cake or a piece of candy or a cookie or something like that, you may. But remember that the MGB has interfered with the gut, so that heavy, greasy foods that in the past would be digested and stored on your bottom or in your tummy or underneath your chin or something like that is going to be blocked. The MGB interferes with digestion and absorption of fat and calories, and that's why you get the weight loss. And again, I started off this talk talking about somebody who's 10 years after her MGB. And she's doing great and still enjoying the weight loss, but she's a little confused because she's suffering from the problem of intermittent severe diarrhea. Okay? And she says, oh, I guess that's just the price you have to pay for having an MGB, and that's not correct. And I want to explain that a little bit. It turns out that Particularly, some things are easy to digest and can never cause, or almost never cause, diarrhea. For example, a glass of water. Water is easily absorbed by our gut, and so we don't get diarrhea by drinking a glass of water. On the other hand, a greasy Big Mac, highly greasy, fatty, greasy patty, that is going to be hard to digest. And in an MGB patient, if that grease that makes up a Big Mac and its special sauce is not digested, that heavy, fatty, greasy food will stay in the gut. If it stays in the gut, that's good because it doesn't go on your bottom. It doesn't go on your tummy. It doesn't go into the arteries to form narrowing of the arteries and lead to maybe heart attack or stroke or something like that. So there's an advantage for blocking that digestion of that fat. But if you have undigested fat inside the gut, the body's normal bacteria will chew on it, will digest it, and eat that fat that you don't. If that happens, so far still okay. You don't mind if the bacteria eat it because you're not going to eat it. You're not going to digest it. You're not going to absorb it. But the problem is when the bacteria digest and absorb fat, the metabolic side products of those bacteria causes gas and cramps, abdominal pain, and diarrhea. So after our surgery, if you eat foods like a glass of water, light meals like an apple or an orange or things like that, those have very little chance of causing gas and cramps and diarrhea. On the other hand, there's a whole bunch of things which, if I mention them, I think you can guess might cause gas and cramps and runny bowel movements and diarrhea. And so I use the example of a greasy hamburger. I could use another example, something really fatty and greasy like a big slab of cheesecake or a big piece of pizza. All of those big, heavy, greasy amounts put into your tummy will cause diarrhea and sometimes cramps and pain and problems. So our patient who called from 10 years ago probably eats a pretty healthy diet most days, and then every once in a while she probably is choosing something heavy and greasy and bad, and that's causing that problem with diarrhea. So I talked to her on the phone, and I told her, you need to investigate and write me a food diary to see what you're eating, and we'll help point out what could be the problem. Now I focused just on fat, but there are other tricky foods you have to be careful of. And one of them is dairy. Okay, dairy contains not so much fat, although cheeses and milks and ice cream can contain fat, but dairy products can also contain a special kind of milk sugar called lactose. Right. Now lactose is exactly like the story I just told you in fat. If you and I eat a lactose sugar when we're babies, because it's in mother's milk or in cow's milk, we usually have a gut that includes the enzyme that allows us to digest and absorb the lactose sugar. So dairy products for kids work great. Most little kids, for example, like a glass of milk. On the other hand, as we age, as we get older, our ability to digest that sugar, the lactose, goes down. So many of us as adults don't drink as much milk. And just like in the story about the fat, if you eat the lactose sugar by taking ice cream or milk or other foods that have lactose in it, and you can't digest the lactose sugar will stay in the gut, the bacteria will metabolize it just like the fat, and you'll get gas and cramps and diarrhea and things like that. And it's especially important for you to understand that for us because the lactase enzyme that digests the lactose is in the upper gut. And we bypass your upper gut. So many of our patients are lactose intolerant after surgery, And there's one more trick. A lot of manufacturers who make different kinds of processed foods add milk protein to their ingredient list because it oftentimes makes the food look better on the back of the package. It has higher protein and lower fat and things like that. So you may be surprised sometimes you're choosing a food that you wouldn't think has lactose in it. You may be careful and it might have lactose or fat in it, and so you might get a surprise and get diarrhea or gas or cramps from that food because it has either fat in it, it may have some other kind of food, or in particular can have lactose. Now in the case of lactose, you can actually help yourself if you want to go out tonight and have a treat, have an ice cream cone. You can take care of that by buying some lactose enzyme at the grocery store. And that goes under the name Lactaid. Right. So let's suppose you want to go out and have ice cream tonight. You know that normally ice cream can upset your stomach and cause cramps or things like that. You can say, but I want to have a treat. I want to have a little ice cream cone tonight. You can open a package of the Lactaid and take 1, 2, 3, even 4 tablets, and that will make the ice cream sugar, the lactose, go down easier. Another option is you can often find dairy products now that are lactose free, and so they can be less upsetting to your stomach. So we can look at that. Another thing to think about is there are just some other foods that cause gas in all of us. And so the examples are like beans, which have a carbohydrate that's not easily digested, or what are called cruciferous vegetables, and that's things like cauliflower, broccoli, and cabbage. Again, because of the MGB, those vegetables can cause more gas because they're going through and have less opportunity for the gut to digest them. So when they're not digested well, again, you can have gas and problems like that. So the MGB, as we said then to finish up for this part, for the video, can be associated with gas and cramps and diarrhea. It shouldn't be if you follow our advice, and that's to generally be careful and avoid lots of very heavy greasy foods, to avoid a lot of dairy products with a lot of lactose, and to avoid those cruciferous vegetables and beans which may have a lot of gas producing carbohydrates in them. Now there's one more important thing to tell you about, and that is that there is now a very, very dangerous bacteria that has mutated in our society. And you've heard about things like the killer flesh-eating bacteria. Well, there's a story about a bacteria which 10 and 20 years ago, when I was a physician as a general surgeon, we almost never saw. Its name is Clostridia difficile. Clostridia difficile. And it used to be an extremely rare infection. You only saw it in ICU patients who were on antibiotics for a long time. And they would get an infectious diarrhea, like a dysentery, bloody diarrhea, and rarely it would go on to actually take somebody's life. Nowadays, it's out in our society. It's out in the rest of the world, not just in hospitals or not just in intensive care units. Clostridia difficile begins as a severe diarrhea. So if you ever do have some diarrhea after the surgery, first of all, remember the first things I talked about, but also beware if it doesn't get better right away to think about this new infectious diarrhea, Clostridia difficile, and either call me or see your doctor right away if it's more than a couple of days. If it's more than a couple of days and your doctor is certain that it's not this terrible, dangerous Clostridia difficile, then call me and we'll work through the foods that you're eating and things like that to give you some guidance so you don't have to suffer from this problem. So that's kind of a long discussion. Any other questions about what to eat? And we have some, is it fair to call them veterans? People who've had the MGB for a while. Any comments? Do what I say make sense and what your experience has been in life and owning an MGB? You're allowed, for example, to have a cheesecake, but if you eat the whole thing, you'll pay for it?
Yes, very much so.
A bite of ice cream is okay?
And a bite is satisfying.
Yeah. But if you go over that,
your tummy will hurt.
right.
And bad carbs too. Do the same thing.
Right, same kind of thing. So if you're thinking about it, if you're having trouble with gas or cramps or diarrhea or things like that, probably you're eating the wrong things. And if you're not comfortable modifying your diet or identifying what's what, call me, because I can often point it out. So I will tell you, not too long ago, about 2 years ago, a lady went on the mailing list and said, I'm really having trouble with my mini-gastric bypass. I have terrible gas, terrible cramps. It's really awful. I'm having a rough time. And, she didn't actually call me. So other people were making comments. And so I wrote her an email. I said, why don't you, tell me what you're eating? And so she wrote back that in the morning when she got up, she would have 2 sausage links, half of a bagel with half a thing of cream cheese, and a glass of milk. And then that's breakfast almost every morning, and she says, then I feel bad all day. I feel kind of crampy and gassy, and then she had these she was eating Vienna sausages, and it was just all the greasiest, worst stuff. And I go, you're kidding, right? You made up this is not really what you're eating. So we changed her a little bit from that really heavy, greasy diet, which she had kind of forgotten about our advice, because she was 3 years out, and she thought those were good choices because she wanted to get protein. And so we told her, your protein's fine, but you're going to hurt yourself with that big blast of fat and protein every day. So.
And the nitrates.
Other questions about your diet after surgery?
When do you know when to transition? Like I'm 2 weeks out, and I would love to have a salad or a tomato, or is your body supposed to tell you I'm ready?
It's a good question. Most people have already transitioned from where you are.
Really?
Yeah, and the reason you haven't is because I have been telling you every day, beware.
Because you scared
I scared the
jeebies out of me.
Right. So you are about ready now. We're at 2 weeks, and it's about time where you can start to take little bits of salad and things like that now that you're 2 weeks out.
Okay.
Is it okay to mention to everybody else your complication?
Yes.
So we went to do her surgery, and her bowel that we used to do the bypass was trapped down in the pelvis, so we had to kind of pull it up. And so it was under a lot of tension, so she had to have a tube in her nose for a week.
Yes, and he literally meant a week.
Yeah, she checked that with me every day to see if I really meant a week. And then every once in a while, her estrogen would get low, and she would threaten the nurses.
They thought I was very nice.
They did most of the time. There were times when I was actively away from the hospital. And I had to call in an airstrike of an estrogen patch and some other medicine so that...
That patch does work.
Yeah, it did work. I gave you some other little sedatives also to help you through that. Dilaudid, Benadryl, Decadron.
Anything you could do.
Yeah, so...
If I take sips of water, is it normal for you to your stomach to start? Because I take maybe 1 sip or 2 because I just really want water. It really hurts, but you can feel that little sip going down and it kind of hurts. Is that normal?
Let's imagine that instead of me operating on your stomach last week, instead imagine that I cut off your toe. Can you have that in your mind for a second?
Yeah.
Okay, now walk on it in your mind. Does it bother you a little bit since I cut it off last week?
Yeah.
So some discomfort can be understandable. We feel bad about it. We don't want you to have any discomfort, but it's not terribly surprising. We want that to get better. Actually, let me turn off all the videos because I think we're done with that one little talk on there.